think one of these, the question here is, are there any trials that could help someone with an NTRK mutation? I think, on the kind of same, along the same lines there, I mean, of course we have FDA-approved options of larotrectinib and entrectinib. So the presumption is that you've been treated with one of those drugs. And then if you develop resistance, then are there trials? There may be trials, again, because this is such a rare driver subset in our non-small cell lung cancer patients. It's difficult to do, specific trials for lung cancer, but there are likely in the phase 1 groups at various academic institutions, NTRK trials kind of across different solid tumors. And I think specifically patients now who have progressed on one of the FDA-approved options. So trying to understand the resistance mechanisms that are developing in these patients. The good news is that these drugs do seem to have a longer duration of response, and they tend to be pretty well tolerated. And so I think we're just sort of starting to understand maybe why certain patients are developing resistance and whether there's other targeted therapy options for these patients.
Yeah, and I think building up on what you just said, there are several drugs that are being looked at right now for the NTRK-resistant patients. And I think the front runners there is repotrectinib or TPX-005, and the trial is accruing. We have it in several institutions, and there are a couple of other drugs which are very early. They're just phase 1, but still. So you will have an option. If you develop a secondary resistance, you just have to look for the site that has a trial.
And I think it's becoming increasingly common, certainly in our EGFR and ALK patients, when they're developing resistance, is to try to do a repeat biopsy at the time of disease progression to really try to understand what the resistance mechanism is. And that's either with tissue or blood. And that will hopefully help us better understand what these resistance pathways are, and to see if there's potentially a targetable drug that can be given at the time of that disease progression.